but I'm interested to know, like, using with outside the context of you know, like those heel excuse me, those heel sliders where you like slide your heels like forward and you're on your back, you're on your back, you have your pelvis elevated and you're sliding your heels on like those sliders. That make we covered that. However, could we use sliders on, let's say, like a split squat variation where you have where you're, as you're lowering down in the split squat, you're sliding like your foot back?
I don't see why not. Yeah, I've used that before, but that also is a lot harder than a regular split squat for sure. But yeah, as long as they're ready for that, I don't see why not.
So would you say with using that kind of modality with or you're doing instead of stepping to the side or moving to the side, you're just sliding that, you're just like sliding that leg out to the side and you're doing that like side, like lateral, like hip hinge thing?
You could for sure do that.
Talk about that, but the reason why I asked is because one of my clients just got some of those for Christmas. She's like, "Oh, we can use these." I'm like, "Let me just check about this."
Yeah, I mean, biomechanically, it's all the same, but it's just harder. So I think if you wanted to look at that as a form of progressive overload, you very well could. But I think it's not really doing anything different within the pelvis, assuming the form is still the same.
Right. Yeah. Okay. Thank you so much for clearing that up. So now I know how to program for that piece of equipment.
Mm-hmm. Sure. You guys have anything?
Yeah, I've got a couple. So I missed the session on Monday, so tell me if this question's just like can be very easily answered. I've looked over the slides in the testing piece for the for the energy system development. When we're talking about so you've got the speed preservation training. So you've got your 2K versus your 5K.
Mm-hmm.
When they're talking about the pace, is that so say for your 2K, you can hold a 140 versus a 150 for a 5K. Is that the or is it the because you're talking about the pace preservation as opposed to the time? It's not like what percentage your 2K time is of your 5K time.
Yeah, it's like, so the pace meaning like literally, so like if I were to go out and run a 2K right now, what would my average pace be for that entire duration? Like that.
Okay, yeah. So you're talking, so it's basically, it's the percentage of a 6 minute mile versus a 6:30.
Yes.
Right. Okay. As opposed to, yeah. All right, cool. Okay, that makes sense. And then on the heart rate step test, it says, so you do your 4 minutes on with 30 seconds rest. It was actually no, sorry, that one made sense. Sorry, it was the heart rate step. Yeah, so sorry, in the heart rate step test example, it says row for 4 minutes for 500 meters.
Mm-hmm.
I don't know what that means. Is that 4 minute a 4 minute pace for 500 meters? Is it?
Let me share my.
Sorry, just clarify what I'm talking about here.
For the people that are watching this later. So just to recap, the idea is that you want to progressively increase, have some rest to allow blood to come in, and you want that to be 50 to 60 minutes of total time. You want to start at a very easy pace, usually 15 to 30 seconds slower than their 4 minute pace. And then, so here you'd want to start at a 4 minute pace for whatever that would be for 500 meters. And then you would want to, so like, for example, 500 meter row for me, gosh, I haven't rowed in like a couple months. I'd say that's probably about two-ish minutes. That sounds about right. You know what? I'm not sure why that's.
No.
I'm not sure why that's there either. You're right. Yeah, I think you caught an air there. Yeah, that doesn't make any sense. That would be double the time. That would be 1,000 meter row for me.
Yeah, cool. So I think that's just you row for 4 minutes at a decent pace and basically get faster by 3 seconds every time you do a 4 minute.
Right. That would make much more sense. Yeah.
Cool. All right.
I'm trying to see where the 500-meter thing would fit in here. I don't think.
I suppose it's the pace that it gives you on a rower is your 500. I think your 500-meter pace.
That's probably what it was. Yeah. Yeah. That's probably what it was, because the Concept 2 spits that out. Okay. Well, thank you for catching that, because that's probably
right.
People probably had that question too. So thank you. Okay. Anything
else?
Cool.
Right. So I mean, this stuff, it's fascinating, right? It's like, and it kind of explains, it's like, it's another explanation why certain things work. Various different protocols are out there. It's it starts to talk about like the principles that underline it, which means, it's good because it does that. Whereas a lot of things are just, here's a program and follow it and it works, but they don't necessarily know why, what the fundamental thing that's underneath it, which is good.
Mm-hmm.
Just like out of interest, do people use this? So like, for me, it seems very, like, it's very cutting edge. And I suppose, to be honest with you, Connor, it kind of links in with everything on this program. I don't know how much of this is common knowledge or is taught in universities or not.
Zero.
So, I've got like, for the whole biomechanics piece, if someone's done a physiotherapy degree, I've got no idea whether this is covered or not.
Yeah.
So this is just, it's brand new stuff but it must be being utilized by, that's the wrong way to put it. Is this stuff that is being utilized by like high performing individuals?
Yes. The guy I got this from, Evan Piken, he worked with probably 5 of the top 10 CrossFit athletes in the world. So this is being used by the very best. And it works. Like it's so much better than just like 30 on, 30 off, whatever that means, right?
Yeah.
No, it's not being taught in universities the same way. Like Bill Hartman or Zach Couples' model isn't being taught in university. There's not enough like hard evidence to like break into academia yet. And I think people are going to be very, like Ron Huruska has said, it's going to take 100 years. It's literally going to take 100 years. And, I think I respect that he said that, because that's very humbling on his end, because he cares about it so much, but he understands he's going to be dead for a long time before this stuff breaks in. So yeah, I think you're right.
Okay, cool. Yeah. And it's good to just understand that as like kind of, concepts. And then do you guys have, do any of you have one of those Moxy meters?
You know what? I've played around with one 2 or 3 times and they're a lot of fun, but I can't justify the $2,000 price tag. But I think when I do open my own facility, whenever COVID's over, that will be like one of my top 3 things, because I do live in Oregon, which is a huge like running paradise. So yeah, I have played around with one. They're a lot of fun, but they're extremely expensive, which is why I provided the alternatives.
Yeah, of course. And I suppose, alternative in terms of kit there, I suppose as long as you know what your pace is, so basically a GPS watch effectively does it with a heart rate monitor, would cover most of those things.
For sure.
Yeah.
Just put it on the company credit card.
Yeah, right. I am the company credit card.
Oh my gosh, so am I for my company.
Could write it off though. That's for sure.
It's true.
Connor, can I ask a question? It's about week 2.
Yeah, sure. Absolutely.
Cool. Alex Effer just made a post just doing like, it was a really cool write-up, but the post was just a staggered stance squat with the back heel elevated.
I have to look that up. Actually, let me do it on the computer.
Yeah, cool.
Okay, while I'm pulling that up, you want to finish?
Yeah, it was I think it was his most recent post. I just seen it. But it's a staggered stance squat with the heels elevated. And then, yeah, exactly. So I actually commented on it because I'm trying to still obviously work through this stuff and make sure I'm seeing things correctly. So I'm confused with the heel reference, whether that is biasing someone towards early stance because of the heel reference, or is that by it saying someone to late stance because the shin angle looks like it's late stance, but the heel, if that's the main method of contact, seems like a heel strike.
I think yes. And I think the heel elevated stuff really confuses people because it looks like the shin's moving forward. But look at where he is at the bottom relative to his foot. He's in a
That's right.
neutral foot. So I think, yes, if I was to give someone this exercise, I would want to be biasing them towards heel strike, external rotation, expansion mechanics on that backside pelvis.
Okay, cool. Because, sorry. Okay, so that's the comment that I put. I guess like the thing I asked him, and I'll just ask you the same question is, I said, you would identify this through the assessment of the foot, so adduction of the toes, because if you've seen late stance feet, you would want to give them an early stance squat variation. Correct?
Yes, this is where things get a little tricky, and I understand where the confusion could be because, like, are you going to give someone toes elevated squat? No. You're just putting their squat into a hinge. So yes, in that case, I would give them a heels elevated, but I would want to overall bring that foot back to mid stance, because think about what a narrow does when they compensate. Narrows will drop their arches or they will have their toes go out with high arches. So what they're doing is they're bypassing mid stance and trying to find a fake mid stance, which ends up being toe off because they never had IR to begin with. So how are they going to get into mid stance? You know what I mean? So they're going to find compensatory IR, compensatory mid stance mechanics. So they try to find propulsion through just going into toe off. Okay. So that's commonly what you see. So I would want to actually bring them back, but I would also I'd want to restore, honestly, like that's why I don't have the foot progressions within the phases, because you start to think too much, and it comes with reps. So I think if it's not like clear up the thorax and pelvis, have that be your 100% primary concern. And if that is still not fixing the issue, it's a foot issue. And if that doesn't fix the issue, it's a neck issue or cranium issue.
Okay.
So you can start to think about the feet will naturally, like if you clear up the phase one stuff, it will naturally come back a little bit. Things should start to look a little bit better. But if things still look funky, then I'd be like, all right, what can we do with your foot to give you a little bit more of what you should have? You know what I mean? So in that case, I would say, hey, after phase one, we've given you ER back and your feet are still stuck in late stance. Now it's appropriate to give you now phase two, because that's IR. That would be mid stance. Let's bring your feet back at that point.
Okay. Yeah.
And I said that really, really fast. I'm sorry.
No, it's okay. I realize that this stuff is just like, it's just reps, and I haven't gotten enough reps. That's why it seems so confusing. But so there's one thing here. It says counter nutated sacrum, because I'm still a little confused at how to identify this through other assessment findings, like counter nutated sacrum, anterior pelvic tilt, femur and tibia, and ER. Can you show me with the pelvic model how you could have counter nutated sacrum and an anterior pelvic tilt?
For sure. So think about what a narrow does when they compensate second layer. They're here, they get pushed from the top, and you go here. You know what I mean?
Yeah, so, concentrically oriented on the backside, because initially they're concentrically oriented on the front.
Yep.
Okay, so the sacrum's pushing forward.
Front, thorax, back pelvis. So they concentrically orient their back anterior, or back rib cage is what I'm trying to say with that, and it's pushed forward like that. So it's an orientation issue at that point.
Okay, and then this kind of looks like I forget the guy's name, but he would refer to as like lower cross syndrome.
Yeah.
Okay, something like that. So, all right, I got it. Thank you.
Yeah. Just really quick, Amy, just to summarize what I said, because I know some people are going to be confused by that. Do phase one first. Just do it. Just get it done. And after that, if you still got a ton of issues going on, then you want to go into phase two. And at that point, and you can start thinking about the feet a little bit more. But overall, I like to see where the feet are at first as a lens to see how they've compensated. So it's very helpful information in that sense to see where their tibias are, what phase of gait they're in. And then, at that point, you want to start to, get them out. You want to start bringing them back. Think about that after phase one. That's what would be my biggest recommendation to beginners. And go ahead, Amy.
Oh, no, I was just had a question of, should we still make those distinctions? Like, are they still useful? Lower cross, like upper cross syndrome? Are they still useful? Are they still relevant? Or is that like an outdated, overly simplified thing?
I don't think so, just because that's what most people know. So I think it's fair to speak in their language if they know it as that. I don't think it's good to like force a language onto someone that they are only going to hear from us and not the rest of the world. So I would just speak in their language,
Okay.
Which requires us to translate a little bit, but I think we all know what lower and upper cross syndrome are.
Okay, Connor.
Go ahead.
I got some questions for you. So I always have to touch and understand things visually. So yeah, I have my pelvis here and I have my rib cage. Okay, which is it's still a bottle, but I hope the Reyes Magos, I don't know how to call it in English, the three, they bring me one. But anyway, so we have a wide ISA. Okay, so the pelvis should be like this, right?
Yep.
Okay, and then the pelvic floor is going to be ascended, right?
That's right.
Because it works like a trampoline, because this is 2 tenths on the bottom, right? Okay, and then for narrow it's going to be exactly the opposite. This would be under 100 approximately, and the pelvic is going to look like this, and the pelvic floor is going to be descended. All right.
Yep.
Okay. Yes. So then this sentence that normally we used to hear, that females got wider pelvis, it is actually true, or is it just because of the orientation of the ilions?
Females have wider Q angle, right? Like that's what you see in the literature all the time. I think it's because females are more narrow ISAs. I think that's why you see that. So when you have a higher Q angle and wider hips, quote unquote, you're like this, and then you're like this, and then your Q angle increases. But if you are wide, sure, that's not the case. So that's basically what I believe is going on there. And that allows for them to have those childbearing hips, because in pregnancy, you need to be able to have that baby come in, but then you have to do this, but then you have to do this again.
Yeah.
So it benefits them to have 2 out of the 3 phases they're already biased towards.
Okay. And when we are born, we have our primary compensation, which is if we get narrow or wide. Okay. So when the pelvic, I see that the femur goes in relative external rotation, right? Okay. Yes. External rotation, internal rotation. Okay. And as soon as we get to compensate, for example, a secondary compensation for a narrow, which will be that his whole body goes as a whole forward. I forget what I'm going to say. Yeah, so this is related to age. That means if we meet a person at 12 years old, he or she would be primary on just the first compensation phase, okay? But if we meet a 60, 70-year-old grandmom, we'll surely find a tertiary compensation, right or not?
I would say you're definitely more likely, but it's not surely, right? Because they've had so many more years to potentially fight gravity and have lifestyle habits that are conducive to compensating, like sitting a lot or not exercising through a full range of motion. For sure. Yeah. So I think you're right that you're going to be 100,000 times more likely to see a tertiary in someone who's older versus younger. because we compress, right? We start to like think about an old lady on a walker, right? What are they doing? They're so compressed that they're just trying to keep themselves upright against gravity because they're just everything's compressed.
So it's like they are like going into level. So if this would be normal posture, then it's anterior pelvic tilt, then it's sway back, and then the last level is just crouching, right?
Every time.
Okay.
Unless you had a traumatic accident, like a motor vehicle. Once you start to have motor vehicle accidents or forces that the human body is not meant to be subjected to through the processes of evolution, you know, like getting hit by a boulder or something, I don't know. Whenever you have something that, like let's say for example, they had a surgery and they lost, you know, a big part of their quad, then things start to get a little bit tricky. You are no longer operating within the means of what a human should be capable of. And then that's when I start to get lost because you're no longer working with a pure human. I just refer out at that point. I'm just like, I don't know.
Yeah, let's try. I also have trouble with differentiating between a flat feet and a valgus of the feet, because I don't know, I don't have my foot model still, and I would like to, if you could show me which is the difference or what you may see as because when we see a client or a patient, we don't see the bones at all. We see was like also this for example, I wear like almost every day minimalist shoes, and I start to have some I don't know how you call it, this kind of hard tissue that is on the end of the on your feet or on your heel. You know what I mean?
So do you want me to go through like, what do you want me to review on the foot model?
Yeah, first then the feet valgus.
Feet valgus. Okay. I got a picture actually of a client I had an assessment with yesterday who has like a genuine foot valgus. And I think it'd be really cool for you guys to see. Actually, we should just, I mean, I don't know if this guy wants his face being shown. I'll show his feet because who cares if it's just the feet. So here.
Yeah, just put the smiley or a heart.
Right. So this is his lower body. Oh, shoot. I got to get you guys out of the way. There we go. Feet. Okay, so check this out.
Yeah, so this should be valgus of the feet on the left, right?
Yes, this dude's got totally collapsed feet, right? So he's just going down like this. And
I have one like this.
This is not
maybe the same one.
This is not pronation. This is straight up a collapse, because pronation at the foot really technically is not really involving the structure of where the tibia meets the ankle as much as this is. It's really this is pronation, right? And that also adds up as to why in toe off, you guys probably couldn't see that very well, but it's mostly like this action right here. You go down and then the big toe flattens, but then because of that little bit of torque that's created, the big toe goes in relative to the rest of the foot. And that's why when you see toe off feet, they're in like that, because pronation is like, look at how little really occurs up here in pronation. This dude's just like that, true collapse. And so what that tells me, and this guy's a narrow, knock-kneed, right? See if we can get him from the front. Oh. Okay. Yes. What do we see here?
Oh my God.
Yeah.
Take him to the rubbish.
Let's just throw this guy in the trash. What do you guys think? What comes up?
Externally rotated femurs.
Yes. I'd say ER tibias for sure too. I'd say that the tibia is actually in more ER than the femur. I
Especially
think
the left one.
Yeah. And now this is interesting too, because the dude has a clear toe gap on the big and second toe. So that tells me he started off there and he compensated into this position right here. And that's why I care about that toe gap, even in these feet, because his feet are just so clearly out. His left one is more than his right. We would expect to see that. And his left is more pronated, I would argue, than his right, but not by a whole lot. The reason why I say that is if you look at this bone right here, it sits and points down a little bit more than this one right here.
Yes.
That's more prominent too, I would say. So this dude's got like some serious stuff going on. His hip flexion was like 80 degrees on both sides. His straight leg raise was 40 on both sides. Rib cage wasn't crazy, but his pelvis is definitely crazy. This dude is like in game right now in his pelvis.
Would you say that his pelvis is collapsing? Like he'd have kind of more of like a narrow IPA?
I would say he was narrow starting out, but yeah, you know what I mean? So you got a narrow ISA, you also got a narrow IPA.
Yeah, because it's hard to tell for me when I look at something like this. It's like, you know, is it the hips that collapse the feet or the feet that collapse the hips? Like, what do you?
Yeah, I think
Does it really matter?
No, I think it's both. I think it's always both. I don't think it's one or the other. I think it's just like the body seeking a strategy to find stability. And I think it's literally impossible to tell, but I think these things happen in unison. And I think that when the pelvis comes forward like this and you're in that anterior orientation, like we talked about before, the knees have to find IR. So they did that. But this dude is still trying to find a propulsive strategy and IR. So his feet collapsed in, his feet turned out. He found his pronation, but that came at the cost of basically torquing his knees with every step he takes. And yeah, we basically I'm going to phase one the shit out of this guy.
Yeah. Okay. So would you be cool with like just kind of obviously not the whole thing, but just a few ideas that you're already thinking about what you want to do? Because when I see this, I think of like you know, cueing the outside edge of the foot, just as like I mean basic stuff like that. Like where's your mind go when you see something like this?
In terms of what I'm going to have him do with his feet when he trains or does drills?
Yeah, that programming wise, like when you say phase one, like could you provide specifics?
I'm going to elevate this guy's feet in a squat, just like we talked about before. I think this guy is so collapsed that, I mean, you can take two schools of thought here. You can say like, you could pronate him more to give him more pronation, which would then cue his supination. But I think you're starting to get dangerous when you're in a position like this. So I'm going to elevate this guy's foot, because if he's like this, you guys can't see that, like that, right? If I put an elevation underneath his foot, he can't really do that. So his arch is going to rise naturally through just biasing him towards heel strike, because I can't really collapse here. Even if
it's going to feel weird.
It's going to feel awful and he just won't want to do it. So I'm going to do tons of heels elevated stuff just to get him back some of that ER that he should have. And I'm not really going to worry a ton about his feet because he needs to work on his proximal stuff first.
Okay. So you're referring to ER in the hip when you say ER.
Mm-hmm.
Okay, because if you ER the femur, ideally the everything else should ER as well, and that will just naturally, it's like the screw your feet into the floor cue. It's naturally going to raise his arches and get him onto the lateral side of the feet.
Yes, but also I think, you know, through just orienting his pelvis back, he's going to not have to be so forward as a whole. So yes, think about it as a bottom up. So if he's like here starting off and then he dumped forward like so, and then, you know, you gave him some of the basics, just like some hamstrings and obliques, which is where we're going to start for sure. He's going to come back like that and he's going to re-access, like everything should.
Yeah. Got it.
From there.
Okay, that makes sense. Yeah, because he looks like he's falling so far forward, he's starting to fall in.
For sure.
Okay, cool. Thanks.
Connor, I'm sorry, I still have so many questions.
Sure.
This is more about programming, because I work with people who doesn't really want to make exercise at all. So I have to be creative on how I program, and sometimes I just cue a 10-minute or 15-minute mobility drills, for example, for very overcompensated people. So I would like to become some suggestions, because, for example, what I do personally is every day I work on my IR, because I don't have IR at all, and I use it also as a warm up when I do a strength training session, or even when I dance. I also warm up with the same movements that I am supposed to do in order to restore my capabilities. And well, there is some controversy, because okay, if we want to get hypertrophy, we should be compressing, but if we compress too much, then we get issues, we get pains, we get overcompensations. So maybe I should alternate bilateral and unilateral movements, so I can have access to that expansion, which only occurs when you do unilateral exercises. I mean, 2 weeks of split squats, and then 2 weeks of front or back squats. I mean, in order to become hypertrophy at all, because when I do this, I have a pulley on my at home, and when I do it with less weight, in order to get air there and back and so on, it's like, okay, I'm not feeling as doing anything, right? Maybe because already I'm white, I say, so I like to compress a lot, I like to get venous compression, and it's like, okay, so I don't know which intensity work on that. And also when I use bilateral loads, also, for example, things like calisthenics, which are all bilateral, is like, okay, so maybe I should try doing, I don't know, running or boxing, which could be more expansion bias disciplines. I don't know.
I get you, man. Yeah. And I just ask you like what your goal is. So if your goal is to build muscle, then I think like you can get so far down this rabbit hole, and I did it too, that you start to forget that like people have fitness goals and like you have fitness goals. So why not allow yourself to chase those things, and even performance goals? Like allow yourself to get those things, but just be smart about it. So if you're working with someone who's got a lot of issues, yeah, I think alternating bilateral, unilateral is good. Or you can just in the session itself have your primary be a bilateral activity, let them have their fun. Secondary be like a Hatfield split squat or something like that. And then tertiary be like, I don't know, lateral lunge variations, like just things like that, where they're, you're giving them their output and you're helping them chase their goals. But I find when I train for hypertrophy, I feel the best when I'm doing like one single leg press, or like Hatfield split squats, things like that, because you can still get a ton of stimulus on one leg. It's just that a lot of people hate single leg work. So it's finding things that people don't hate. People really hate split squats, but people don't hate leg press. So I think that could be a way to do it. But yeah, I think you're on the right track, and I think you should play around with that stuff and then test and retest, see what works for you. Do a session or an exercise of something, test yourself. If you got better or you didn't get any worse, then I'd say that's probably, an activity that you could do all the time. If you did something and you dramatically got worse, then I would say, okay, well, understand how you would want to then balance that out. So I would just use your objective measures, because those are going to lead you towards the right path most of the time.
Yeah, that's what I do. Just as soon as I wake up, I do one toe touch, one squat. Squat is absolutely shit at the beginning, and then I do these IR things, hamstring bridge, and so on. And then I squat full with a little butt wing. So but the thing is, okay, I am going to get better and better, or it's always like starting over every day. Because you're a white, you are like married with with your hinge.
If you really want to see long-term progress, like that's the thing, you can manage this stuff super easily. I can keep someone where they're at really easily, but to actually have these things stick requires a degree of consistency that a lot of people aren't willing to do unless they're coming to you specifically for, hey, I have this issue, I want to get it better. But if you're working for someone who has performance or fitness goals, they're never gonna do the things at home enough for it to stick unless your training is so on point that that's really what you're going for. So if you do have someone where they have a lot of issues, I tell them, I say this sentence to almost all my clients, like, I'm providing you the tools, I'm providing you what to do, but the ball's in your court for how quickly you get better. So I recommend you do 5 sets of 5 breaths on these exercises every single day. If you do more than that, you're probably gonna see quicker results. If you see less than that, then you're not gonna see as quick results, but that's your choice to make. So you kind of put it on them a little bit, because then the expectation is set. And that way they can't come at you later and say like, well, why aren't I getting any better?
Yeah, because you don't do the exercise. Last question. I have some trouble when I do the exhale, because I think I have also a very over stimulated rectus abdominis. So for example, if I do a cranks, like very, very cranked, I get like, a muscle cramp. So on the first 2 abs, for example, it's like something is on and the rest is relaxed. Yeah, pretty weird. But anyway, the different action of the internal oblique and external oblique, I don't really get it. And I don't really get because on the previous review session, or maybe the last, I think it was the energy development session that also we talk about this. When do you feel that your rectus are taking too much work? When do you feel that, okay, I feel my obliques and like, okay, what the fuck? How? Because I can activate my stomach in different ways. I can do the stomach wave, but I don't know when I'm using the obliques or the external obliques,
It's literally just if you can feel them. That's literally all it is. So if I got myself in an all fours position on the ground right now, and I were to exhale in this position, if I get my 6-pack kick on before my obliques, then you know. But if I feel my obliques kick on before my 6-pack, then I know I'm probably in a much better place. So if you do have someone kick on their obliques and they're very 6-pack dominant, you want to put them in sidelining positions, and positions where you're going to get lateral compression.
Okay, because that lateral compression is going to help me to bias into internal oblique and external oblique exhalation. Okay. All right. Thank you very much, man.
Of course.
I'm done. No more questions.
I have a question. And thank you so much for your questions, Liv. Great stuff. Okay, so what if you have somebody who they need IR and another person who needs ER, both hyperextend their knees? I refer this to you.
Well, I would think about the layers of compensations and how you start to look the same the deeper that you get. So if I've got a narrow with hyperextended knees are usually like an ER problem. Like I've got a ton of ER. So they're going to narrows go here. Maybe what happened with them is they're forward now. So now they are in relative ER of their femurs to start off with, but now they're in a little bit more relative IR, but they still have that femur that likes to go out, and then the tibia likes to follow it out. So then maybe in an attempt for them to find a more neutral center of mass, because if I arch my back, my weight goes on my toes more, I could just hyperextend my knees, and that solves the problem. Similarly for wides, what you can see is they start off here, IR bias. So they're already in a degree of anterior pelvic tilt, but if their adductors compress them more, they start to go secondary and they get pulled forward a little bit more, then they could hyperextend their knees and then attempt to find a more neutral center of mass. And that also, when they do that, I have a post on that, why more people have more external than internal rotation. The adductors pull here, down and forward, which pulls out the femurs into ER. And then they're like, oh crap, I gotta now hyperextend my knees, or I'm going to fall too far forward. But it's also hyperextended knees are, like I said, an ER thing. So I would imagine that that person is like that.
I have a second question relating to like true shoulder flexion. I mean, when we think of getting 180 degrees of shoulder flexion, how to truly test that is if someone has like turning their arm, they're laying down, and we see that deviation of the elbow. But can that person with limited that doesn't perceive themselves to be limited in shoulder flexion, because they can do things like they can go into a handstand, they can do like pull-ups, you know, like that. But it is because they are like lacking true shoulder flexion. Are they giving themselves damage by doing that?
Hard to say, but I will tell you what they're doing. Sometimes, and this is the thing, sometimes people can create a compensatory strategy that's successful, and because that's why they're there. You know what I mean? It's like the body's trying to hurt itself. It's just saying, I want to find range of motion I don't have otherwise. So I'm going to do it. And it's going to go around other structures. It's going to compensate, but sometimes that works and they can go their whole lives. It's just like you can smoke a pack of cigarettes every single day and not get lung cancer. It's kind of like that. So what they're doing when they push out, they're going into internal rotation, probably because they're forward and biased towards IR. So when they go up, they don't have the ability to keep that external rotation and do that. What they're really going to do from, I don't know what the best perspective to show you this is, but they're going to roll in like this, which creates that moment right there, like so.
Because especially when I see people like in yoga classes, and like also like on Instagram, and like I'm seeing like obviously compressed dudes like doing handstands, doing headstands, and they're accomplishing the job. They're accomplishing the job, but it's not, but, and they're sustaining themselves, but for a period of time, but those elbows are very bent, and the shoulders are super shrugged. And by having like that limited shoulder flexion, by having that limited like shoulder flexion, should we advise those people to not do hand like those types of positions and movements if they have that compression in the back of their rib cage? Like, don't do handstands until you have like given yourself more expansion.
I think I would honestly probably say no. And I think it's for purely psychological reasons, simply because like, I don't know, like I think if we're using your example, Amy, because you're a yoga instructor, and I feel like if a guy is doing a handstand, like that's something he's worked for, and that's something that he really cares about it. So if you were to take that away from him just because he doesn't have enough adequate shoulder flexion, like he's probably going to look at you and be like, I'm doing just fine. So I think.
Oh, no, I wouldn't be like an asshole. Like,
no, I know you wouldn't. You'd be the nicest person on earth. But I'm saying just like I think if it's something like I'm just doing a handstand every once in a while, I think that's okay to, say like, you realize like you're engaging your traps and doing these things. You could probably say it much nicer than I could, but I think it depends on how invested they are in it. And I think I'm always hesitant to take something away from someone that they're really passionate about. That's just my 2 cents. But yes, if they're engaging their traps, they're just using their traps as upward rotators instead of getting that adequate upward rotation through their serratus and low traps.
Right. Because I mean, a lot of times it's like, oh, well, I've done the movement. I've accomplished the position. And I mean, there's a difference between like actually owning the position and then barreling yourself into it. And when we barrel ourselves into and rush into positions, then they do not adequately serve the body.
See, I
And
told you you'd say it better than I would.
Can I just because we hear the gymnast. Do you mean when they are doing a handstand that they look like a banana, with not like with his arm over the shoulder and all the back flexing, like as if the shoulders were in a anterior pelvic tilt? You know what I mean?
I see a lot of this. They're like, oh, bro, I'm doing a handstand. Like, yes, you are balancing on your hands, and yes, you are inverting yourself, but but are you breathing well in it? No.
Well, yeah. That's something I sometimes figure out, because when you do a handstand, you can choose whether to have your shoulders retracted or protected, because there are some people who say no, they should be like this. Gymnasts normally say they should be like this, because then the trapezius become the abductors,
Right.
or the glutes. I don't know, because you're, and for some clients I've had with this issue, I just tell them to put them on the position of the handstand and bring their head down, so that forces the rib cage to go down into an exhale position, and that helps them to become more range of motion. But I suppose that's going to be a compensation, because they maybe lack of ER or IR, because I did the test myself for shoulder flexion, and I don't have the whole shoulder flexion, but I can do a bridge easily. I can do a handstand with over inclination with no problem. But that's because I compensate with my upper back. That's what I feel, because the test is a test. It's like, oh shit, I'm already here, and it's like, yeah, but I can do the handstand. So the exercise I tell them to do is, I don't know if I'm going to make a mess. It's just to make them put on against the wall. Okay, so that's the dog back. Okay, so I'm here. Okay, and they look like this, right?
More so like this. Like their elbows are not straightening.
The elbows are where? Like,
elbows are kind of like pointed out to the side.
Oh yeah, okay. So I just tell them to open up a little bit more and put the head like this. And this helps them to become more shoulder flexion and also pushing. But yeah, some of them, they don't have the full elbow extension. So it's like, yeah, you're está deformado, and you are not well built. It's like, okay, work on your upper conditioning, and because the later you begin to do handstand, the less you can get adapted to that movement. So right. I just focus with like them on. Yeah, tell me.
The thing is that like the difference of like a handstand for like the yoga asana practice and a handstand that you would do like in gymnastics, they're actually completely different. Same principles, but the goal is different. Like you want to be relaxed and alert in like a handstand, like in a yoga practice, because because what you want to do is calm the nervous system, is to slow down. That's the goal, is to slow down the nervous system and to make your breathing longer and have more duration between your inhales and your exhales. Okay. And so you want adequate muscle engagement, but not so much rigidity that you're constricting like your rib cage from expanding and contracting as well. But also, like, one of the ways that before COVID, what I used to do, and I've been kicked in the face so many times spotting handstands, like, it's not funny, but it is kind of funny because it kicked in the face.
Well,
but what I've done is, like, somebody goes up and then they kick both their legs up, and then I have one of their legs pressed down into my leg so they can find that orientation of to feel a little bit more not so much stiff in the shoulder, but orient themselves within the trunk as a way of not so much like barreling themselves up, but finding that reorientation of the elbows, the reorientation of the shoulders, and how to stabilize the scaps.
Yeah, but
I don't know.
They need to. I think I got what you mean, but they definitely have to pull a little bit, because otherwise you are compressing the humerus against the scapula. So
right.
you
yeah.
I get what you mean. So you can make a handstand with pointed feet, very tight legs, tight butt, everything is tight because you are doing a planche or whatever. But if you just want to hold a handstand, I would say also something that helps for balance, because if you don't have the balance for the movement, you're gonna be compressing even more. So
yeah, that's why you do something like this.
Yeah, that's perfect. Yeah. Because that little pressure on the wall is gonna help them to train the balance without too much compression. And also one thing is to have one leg in front and then on the back, and then you can switch, like extending and bending your knees in order to keep the balance, because if you don't have easy balance, then it's impossible to focus on breathing and all what you mean. So the easier the task, the easier it's going to be.
Exactly. And like I think the wall is like gives you more reference. But I say to like students who I've been like monitoring their progress, I'm like, you're going to have to eventually break up with the wall. You're going to have to break up with the wall and try kicking up or try pushing up into handstand in the middle of the room. And most people are they're afraid. And what I love about this certain type of movement is that it not only like teaches trusting yourself, but also teaches it's a great way to monitor like one's progress and to not be afraid going forward too. Yeah, so, like if I have a really timid client, I will teach her. I'm like, hey, you want to do handstands? And she's like, oh, I've never done them before. They're scary. I'm like, all right, all the more reason to do them.
Yeah.
Are you guys reading Kim and Keith's comments?
Oh, yes.
I'll read them off.
Kim is smarter than me, so yeah, just ignore everything I say.
No, I think that was a good dialogue. I think they just have some good points to add. Kim just basically said, like, and Keith also touched on it, it's like a cost-benefit analysis, right? Like, if they're going to be really good at what they do and they excel at it, then be hesitant to change things. I mean, you guys weren't talking about like the highest of high-level athletes, but I think it's just an important consideration to have. But yes, Kim, those people are incredibly compressed, and it's really like gymnasts. There's just like a whole nother level. But yes, gymnasts are some of the most frequently injured people I've ever worked with. And I think Keith also has a really good, you ever have a high level athlete? I think this is a good question to ask, or just a good point to make, tell them the cost of what they're saying in the time frame they want. And I asked them if they're okay with that. If they say yes, we proceed. If no, we adjust. I think that's very responsible and fair. So thank you guys for adding that. Do we have any closing thoughts as we wrap it up here?
Yeah.
Cool.
Great chat. I'm always learning more through it. Like dialogue is important to the learning process.
It is very much so. I appreciate you guys for showing up. You guys are always very consistent, which means more to me than you guys realize. So I will talk to you guys next Monday for case studies.
Next year.
Next year. Okay. Bye.